do pain management clinics work? And being a pain management specialist myself, I was really in my feelings as I was reading through this article that suggested pain management clinics, traditional ones, aren't effective. And the fact of the matter is, I was wrong. If we haven't met, I'm Dr. Orlando Landrum, an interventional pain and regenerative medicine specialist who helps patients understand their options for pain control, how to be able to know how to punch pain in the face and get back to leading the life that they deserve. So, in this article, one of the things that was mentioned was the context of pain management and chronic pain having been treated by a number of different conventional pain clinics. And those pain therapists that they made mention of are traditionally anesthesiologists, which is what I happen to be. And they talk about the training is primarily in how to numb pain. Well, I would say, quite frankly, our training isn't just how to numb pain, it's also how to be able to get to that area safely and how to be able to target it. But I was really perturbed initially about, well, we're being typecast and it's a small um, bucket that we've been put into. And maybe this article really isn't giving the fair, true gist of what pain management clinics are actually all about, which is typically to be able to help patients not be on opioids or be able to just kind of find a way to numb it, but how to really be able to try and treat it and be able to be functional. But actually, I was wrong. When you read this article in depth and detail, it actually has a lot of good points. And one of the things that it talks about is whether individuals can be able to find doctors that will help with regenerative medicine treatments that can be able to help heal injuries and be able to improve problems in a more effective, sustainable way. But one of the things that they really talk about is the use of interdisciplinary clinics, and they give a really accurate account of that back in the 1980s there were a number of multidisciplinary pain programs which really did have some degree of efficacy. And what they saw is that clinics that actually used things that combine things like medical treatment and physical therapy, that they actually had more stable results over time, right? And so when we take a look at that and have some understanding about it, it's really where we're able to meld a connection of how do we treat and approach the patient as a whole person as opposed to just a disease. And knowing that one treatment option isn't just the best option, that we need to really look at how to be able to blend different offerings in order to be able to get a good result. And so this paper goes on to talk about, or this article goes on to talk about how initially these clinics did a number of different things, but really as insurances started looking at how to be able to provide efficacious treatment options, there was a strong push towards pain medication, as well as it was difficult to really be able to provide relief to the various different interrelated specialties and treatment options that were all underneath one roof. And so things that they talked about are different aspects of medication management, physical therapy, cognitive behavioral therapy, and then some complementary and alternative therapies, things like acupuncture, biofeedback, chiropractic, massage therapy, laser therapy, nutrition education, neurofeedback, and stem cell. And to be frank with you, as I was reading this, I'm like, yeah, they got it right. Now, do I think traditional clinics have no value? Of course not. I think that they can be able to help people. But as we start looking at how can we be able to really get down to treating patients with a more progressive and thoughtful methodology, it really revolves around how can we be able to take all the aspects of a pain patient from the nociceptive, which means that aspect that is showing you that this is a discrete pain problem that has painful stimulus that needs to be addressed on an anatomical and physiological method, to being able to look at what are the support structures and whether there's some deficiencies there. Do you have problems with being able to say, who can you turn to? How can you talk about things that may give you issues? Whether it's the context of being able to do your activities of daily living, like being able to walk and brush your teeth and get around, and who helps you with that if you need help, to you having rightfully and expected mood and just overall thoughts that actually contribute to having a poor outcome, because pain makes you think about your life in a different way. Are we assessing that? Are we evaluating that? And how can we be able to improve that? And when we look at the broader scope, really those things all work in conjunction to be able to provide a better way of getting at the root of the problem of pain and being able to help that patient be able to not just be a patient, but to be a person. So, did the article have it right where we talk about that context of looking at, do pain management clinics work? Well, at the end of the day, I think pain management clinics work when they work the right way. And that is by looking at different ways to be able to make up for deficiencies, as well as making sure that patient knows that they have a broad range of therapies that are available to them and that those options are fit for really the disease processes that they present with. Question of the day: have you been to a pain clinic that has an interdisciplinary or multidisciplinary approach, where they look at not just an injection or medication basis, but have said, how can we be able to provide and deliver other offerings that have value and have a scientific backing? If that's the case, please let us know your experience and how it provided value to you. If you found this video helpful, please hit the like button. And if you are interested in other videos like this, please hit the subscribe button so you can be able to get access to other videos that can teach you how to be able to punch pain in the face, get back to leading the life that you deserve, and enjoy the things that you want to do. Thank you so much. So, this article is one that talks about the history of pain management and how there is some degree of lacking in how patients have been treated. And what they talk about is the use of most pain management physicians currently fall in the fields of anesthesiology, neurology, psychiatry, or physical medicine and rehab. And when they get into the context of talking about conventional pain management clinics, they mention that the vast majority of conventional pain management clinics are run by anesthesiologists. I was like, wait, I'm an anesthesiologist and I think I'm pretty darn good. So, what's the problem? Well, one of the things that they actually go on to say is that they believe anesthesiologists really function and focus on dealing with predominantly how to be able to numb patients and how to be able to do predominantly injections that focus on how to deal with the pain in the short term and how not to be able to deal with it in the long term. And what they make mention of is finding a physician who focuses on different stem cell injections or PRP, otherwise known as orthobiologic treatments. Well, I happen to do that. And I'm like, you know what? They make a good point because when you compare traditional treatments to regenerative medicine treatments, many times regenerative medicine treatments can be able to provide a much longer and sustainable option that helps that patient by providing treatment that actually gets them back to being able to do the things that they want to be able to do, as opposed to just tolerate symptoms and be able to do some of the things that they want to do. It goes on further to talk about what is the history of pain management and how efficacious those things were or how effective. And so the things that they make mention of is the context of interdisciplinary or integrative clinics. And historically, pain management was really reliant upon a blend of different disciplines that dealt with medication management, physical exercise, cognitive and behavioral techniques, stress management, and a whole host of different treatments that really were useful for patients and provided a blend, a compendium of how to treat that patient as a whole. And when we looked at that, one of the things that you're able to see is that patients did better. Go figure. But one of the things that was challenging with that was how to figure out how to be able to make all those different specialties interconnect and how to be able to provide value to the patient and make sure that they're not lost in the shuffle. So, one of the things that this article goes on to kind of mention is that that's coming back and is coming back with the intent on really being able to provide treatment that can focus on things like physical exercise, be able to focus on acupuncture, biofeedback, massage therapy, chiropractic treatments, nutrition, laser therapy, neurofeedback, and regenerative medicine. And when you look for a clinic, looking for a clinic that is able to provide that breadth can be able to impact your health in such a much more strong and impactful way. And to be honest with you, that statement, that suggestion is correct. And to tell you the truth, it was one of the times as I'm reading through an article and I was incensed and like, oh, I don't believe they're talking so bad about pain management and how we could be better, that it was right. To be able to look at a pain clinic that approaches you as not just your disease, but as a person, how it can be able to deal with the nociceptive, or meaning the aspect of the pain, but also your support system, your mood, your mentality, how it affects your sleep, how it affects your work, how it affects your play, how it affects your love life. Those type of context of clinics really help you be able to get after your why and get you back to leading the life that you deserve. Question of the day. Have you been to a pain clinic that is interdisciplinary or multidisciplinary in nature? If so, what were some of the treatment options that they provided to you that helped you be able to be better? If you like this video, please give us a like. It really helps our channel be able to progress. And if you would like to be able to see other videos in a similar vein, please hit the subscribe button so you can get more content that helps you be able to understand your options for pain relief, how to be able to punch pain in the face, and get back to leading the life that you deserve. Thank you.